You gotta show the... Having loved ones with OCD is hard. I hope that after hearing this information, it will give you a better understanding of the disease. According to emedicine.com, approximately 3.3 million people suffered from OCD in 2010. My goal is to give you the information that you need to understand OCD. This speech will give you the understanding of OCD, who is affected by OCD, the signs and symptoms of OCD, and the tools to help you treat OCD. According to MayoClinic.com, OCD is simple to understand but not simple to treat. OCD is an anxiety disorder that causes uncontrollable obsessions and compulsive and repetitive rituals. This disease takes over one's life and may even cause them to not have a job and to cut ties with family and friends. There are two parts to this disease. First is obsessions. Obsessions are thoughts, images, or impulses that happen over and over again that make the person feel out of control. These thoughts may include uncomfortable feelings like fear, doubt, disgust, and having things just right. The second part is compulsions. Compulsions are repetitive behaviors or thoughts that a person is trying to make the obsessions go away. Compulsions are a quick fix for situations that trigger obsessions. Along with having obsessions and compulsions, people with OCD fall into 5 categories. First are washers. They are afraid of getting dirty, and they have obsessions with cleaning and hand washing. Second are checkers. They are constantly checking things, and they're checking things that have to do with harm and danger. Third are doubters and sinners. They are afraid that if things aren't perfect, that something bad will happen. Fourth are counters and arrangers. They have obsessions and superstitions with numbers, colors, and arrangements. Last are hoarders. This is the most common type, and they are in fear that if they throw something away, then they might need it and then not have it. Now let's move on to who is affected by OCD. According to emedicine.com, anyone and everyone can have OCD. Men and women are in each ethnic group is equally affected. Men show signs of OCD between the ages of 6 and 15. Women show signs between the age of 20 and 29. If you have a family member with OCD, you are more likely to have OCD. There are no known causes of OCD, but it is thought to be caused by a serotonin in your brain, life stressors like childhood abuse, chromosome or a gene variation. How are you diagnosed with OCD? Doctors will give you a test screening of questions, and will also look for obsessions and compulsions, signs, and they use a mental exam. Now let's move on to how to treat OCD. After you have been diagnosed with OCD, you and your doctor will discuss your different options. Before discussing your options, they will take into consideration age, medical history, extent of the disease, and your personal tolerance. The most effective treatment of OCD is therapy. Cognitive behavioral therapy includes exposure and response preventions. This involves repeated exposures to your obsessions. This way of therapy will help you learn that you don't need your rituals to rid of your anxiety. Next is cognitive therapy. This type of therapy forces you to realize that your repetitive behavior. Next, family therapy. This not only helps the patient with OCD, but also helps the family understand your disease. Last is group therapy. This helps the patient with OCD realize that they are not alone and have someone to talk to. Self-help is another option that you can overcome OCD. First is refocus your attention by doing something you enjoy. Next, write down your thoughts and worries, and finally, practice a relaxation exercise. I hope that after hearing this information about OCD, the signs and symptoms, and the tools to help you treat the disease, I hope now that you can walk away and either help yourself or help someone else who has OCD.